Hello, everyone, and thank you for joining us today for our policy webinar on steatotic liver disease, SLD, the missing piece in the NCD puzzle. My name is Nicola Bedlington, and I have the honour and privilege of moderating today's session, hosted by the Healthy Livers, Healthy Lives Coalition, and we'll hear a little bit more about the coalition later on. The objectives of our webinar today are to take stock of the positive discussions with and within WHO and other NCD stakeholders regarding SLD, and to really reflect on the priorities of the liver health community moving forward, also in the context of the upcoming World Health Assembly. Participants, you're very, very welcome. If you have any questions to our speakers or panelists, please put those into the Q&A. And if there are several questions, then of course, panelists and speakers will respond in writing, and we'll try and capture the essence of the questions in our panel discussion a little later on. But first of all, we'll listen to brief presentations from our esteemed speakers, and then, of course, have the opportunity to exchange and dialogue in a panel. So without further ado, allow me to welcome His Excellency Dr. Khaled Abdel-Ghaffar, Minister of Health and Population in the Arab Republic of Egypt. Thank you so much for joining us today in your very busy schedule, Dr. Abdel-Ghaffar. Please, the floor is open to you for some opening remarks. I'm afraid we cannot hear you yet. So I think we will move on then. And I'd like now to invite Professor Alexander Krag, Secretary General of EASL, to say a few words of welcome. Thank you so much for joining us, Alexander. The floor is yours.
Thank you very much, and good afternoon, everybody. Ladies and gentlemen, a pleasure to welcome you all. I'm Alexander Krag. I'm serving as the Secretary General of EASL, which is the European Association for the Study of the Liver, which is a medical society dedicated to liver health in Europe and globally. With almost 6,000 members worldwide, EASL stands committed to advancing liver research, top-tier education, but also advocate and promote liver health. So why are we here today? There are important things happening. The landscape of liver disease in Europe is undergoing a concerning transformations. The confluence of socio-demographic factors, and unhealthy behavior exacerbated by challenges within healthcare system. So we need early diagnosis, but also preventable most of the liver disease. And they are facing challenges arising from social inequities, pervasive lack of attention, and I think deficit in political will. So let me say a little bit what we're up against. So metabolic dysfunction associated steatotic liver disease, a difficult name, SLD, formerly known as NAFLD, non-alcoholic fatty liver disease, is a major public health threat. It has a very high prevalence and related morbidity and mortality. It is actually the most widespread liver disease worldwide, with an estimated prevalence of stunning up to 38% of the global adult population. And I think even more worrying, 13% of children and adolescents. So the question is, how do we, societies, how do we policy change this to protect our citizens better? I think we start with awareness. So this is an urgent health issue, and EASL, together with the sister societies in North America, Latin America, and Asia, has recently formed a global coalition named the Healthy Livers, Healthy Lives, to come together under one flag to work on this. So the initiative with the primary objective is to elevating the profile of liver disease on the global stage. Healthy Livers, Healthy Lives Coalition will work towards the ongoing process of integrating steatotic liver disease in World Health Organization's non-communicable disease portfolio, where it's not seen yet, but basically deserves and belongs. So the question is, how far are we and where are we going next? So we already started last year, May last year. EASL convened, I think, a groundbreaking event on the sidelines in the 76th World Health Assembly in Geneva. And in partnership there with national, regional liver association, sister organizations in obesity, diabetes, heart diseases, and also many patients' advocacy groups. So that was, I think, the important start of the global community coming together to raise the alarm here. Now we build on this momentum going forward. And EASL will again in May, in partnership with Global Liver Institute, host a side meeting during the World Health Assembly 2023, May 27. So this will serve as a follow-up, continuing our commitment to mobilize a global action for liver disease. So I'd like to end here with thanking all of you coming here together. So let's try to drive forward this vision. I think a dream of a healthier liver and a healthier lives globally. Thank you very much.
Thank you so much, Alexander, for setting the context so beautifully. That's excellent. We're going to see if we can get Dr. Abel Ghaffar online now. Let's try for a second, and if not, we'll move on to Professor Grace Su for some further words of welcome.
Good afternoon, everyone.
Could you put your camera on? Is that possible?
The minister has not arrived yet. He was with the prime minister, and he has 5 minutes delay. He's just on his way.
Okay, that's absolutely no problem at all. Thank you for keeping us informed.
Thank you very much.
We will now then move to Professor Grace Su, President-elect of the American Association of the Study of the Liver. Grace, thank you so much for joining us today. Over to you. You're on mute.
Excuse me, sorry.
Perfect.
Hello, everyone. My name is Grace Su. I'm the president-elect for the American Association for the Study of Liver Disease, AASLD. And I'm very grateful to be representing the AASLD for this global symposium on one of the most common and important liver diseases affecting more than 1/3 of the world population. As you know, AASLD with its global sister organizations have taken a multifaceted approach to support MASLD, metabolic associated steatotic liver disease nomenclature change. And this is the first step to recognizing this important disease through engagement of government agencies, translation of resources, educational materials, webinars, solicitation of endorsements, and stakeholder engagement. We're committed to facilitating a smooth transition to the new nomenclature for the benefit of patients, healthcare providers, and the scientific community. AASLD has actively engaged in key government organizations in the United States, including the National Institute of Health, Food and Drug Administration, Center of Disease Control and Prevention, and we have held multiple meetings to discuss the importance of adopting the new MASLD nomenclature and its potential impact on public health. Conversations surrounding the technical implementation of the new nomenclature have begun in the United States. And to ensure that the MASLD nomenclature reaches a broader and a worldwide audience, AASLD has taken the initiative to create translated web pages for MASLD resources, which we hope that you will disseminate. These translated resources are designed to make the transition to the new terminology easier for healthcare providers and patients in non-English speaking communities. And they include comprehensive educational materials such as PowerPoint presentations with accompanying videos that explain the rationale behind the change and its potential benefits to patient care and research, and an interactive decision tree to help clinicians reach the proper diagnosis. Recognizing the importance of industry and other stakeholders in the healthcare ecosystem, AASLD has held meetings and discussions to foster understanding and collaboration. And industry involvement is crucial in ensuring successful implementation of the MASLD nomenclature change in clinical practice. While there is much to do, we are very excited to be part of the global community, and AASLD is committed to being a member and leader in the advancing global understanding of steatotic liver disease, arming our community with tools that it needs to educate its patients. Thank you for hosting this and including us.
Thank you so much also for a very, very clear overview of the educational resources now available for this transition. I would now like to welcome Dr. Khaled Abdel-Ghaffar, Minister of Health and Population in the Arab Republic of Egypt. Thank you so much for joining us today in your extremely busy schedule. The floor is yours for some opening remarks, please.
Thank you so much, and good afternoon for all of you. And my dear colleagues, I'm delighted to once again participate in this distinguished series of Steatotic liver disease organization by the European Association for the Study of the Liver Disease. I'm pleased to contribute to the global response against fatty liver and to support the remarkable advocacy efforts led by the EASL governing boarding and addressing this important epidemic. In the face of significant challenges hindering global efforts to eliminate hepatitis virus, thereby impacting the WHO's 2030 targets for elimination, it has become apparent that specialists urgently need to address the new disease burden affecting the liver. This holds true not only for developed countries, but also for developing and low-income countries, where the escalation of risk factors has been exponential. The landscape of chronic disease in Egypt has undergone a drastic transformation over the past few years, and marked by the decreasing prevalence of viral hepatitis C and increasing prevalence of metabolic-associated fatty liver disease. The prevalence of fatty liver disease has risen to alarming levels, placing an enormous burden on individuals and the healthcare system thereby in Egypt. Over the past few decades, the nutrition pattern of the Egyptian population has witnessed an overall increase in energy intake. There has been a shift to a diet characterized by high consumption of fast food, red meat, vegetable oils, processed foods, and soft drinks, accompanied by a decrease in the intake of fresh fruits and vegetables. It is estimated that up to 40% of fat consumed by women in Egypt is saturated fat. And rates of low intake of fresh fruits and vegetables in Egypt have reached up to 80%. So the fatty liver disease is often an undiagnosed in real-world setting, with most patients being diagnosed incidentally when cirrhosis has been developed. And I can say that Egypt is among the top 10 countries with the highest level of obesity worldwide, and more than 71 of adults men are overweight and 26 are obese, while 79% of adult women are overweight, with 48% classified as obese. And the prevalence of fatty liver disease has risen in parallel with the aforementioned changes, and although data on the magnitude of fatty liver disease in Egypt is limited, available data from the most recent studies suggest that Egypt has one of the highest prevalence of fatty liver disease among more and affecting more than 1/3 of the population. And in this case, the Ministry of Health and Population of Egypt is currently formulating its health strategy for the period of 2024-2030. And one of the important key pillars of this strategy is to ensure accessibility of nutrition, safe, sustainable, and reasonably priced diets that is in turn will enhance nutrition and directly contribute to the prevention and management of steatotic liver disease. Additionally, we are in the process of preparing for the new stepwise survey on NCDs planned for 2024. This survey will include a pilot assessment of the prevalence of liver steatosis in Egypt. Finally, our resilient network of viral hepatitis treatment centers, which played a vital and pivotal role in the elimination of HCV, is currently implementing a task-shifting model for the diagnosis, treatment, and monitoring of patients with steatotic liver disease. Now we can truly consider liver disease as a missing piece in the NCDs puzzle. However, I believe that through our ongoing conversations, advocacy, and sharing of experience, this missing piece will come crucial in revising not only the path towards healthy livers, but also towards healthy lives. And I thank you so much for your attention.
Thank you to you very much for painting that very dynamic picture in the context of Egypt. That's fantastic. So let's now move on to welcome Professor Jeffrey Lazarus, who, among many other things, is a member of the Healthy Liver, Healthy Lives Coalition that we heard a little bit about earlier. Jeff, wonderful to see you here. Perhaps you can give a little bit more of an overview about the coalition and its goals, but also your perspective on the current landscape. The floor is yours.
Great. Well, thank you very much, Nicola. Thank you very much, Honorable Minister. Your commitment means so much and is really an example for the entire world to follow. We learned so much from what you achieved in hepatitis C as well, and the recognition WHO gave you. Thank you to the fellow participants, including from ASLD and EASL, and the hundreds listening around the world. So I'm going to tell you a little bit about Healthy Livers, Healthy Lives and my perspective. I mean, I'd like to firstly, from a policy perspective, emphasize the high and growing prevalence of MASLD and MASH, the importance of awareness and early diagnosis, and the central importance of collaboration across professional societies and patient advocacy groups, not just liver groups, but also endocrinology and diabetes and obesity management, in order to expand the community of practice and address this as a public health threat. This is a central goal of the Healthy Livers, Healthy Lives Coalition that brings together professional societies from around the world. Let me make 4 points briefly within the policy context. The first would be the central role of public health in closing high prevalence issues. Sometimes, though I think rarely, can medical orientations close the gap alone. More often, to make great strides in addressing morbidity or premature mortality, there needs to be a public health intervention or set of interventions, for example, a whole of society approach alongside the medical interventions. In terms of structural determinants, I'll mention just one. In the interest of child safety, the barriers are remarkably high to researching the diseases and conditions that impact children and youth. We have lower overall prevalence for children of MASLD and MASH compared to adults. That makes sense, but left unaddressed, these children will soon be entering adulthood at potentially disproportionate risk to adult onset metabolic syndrome patients, including steatotic liver disease, MASLD, MASH, MET-ALD, and even ARLD. Social determinants, we can see a strong association between metabolic syndrome and mental health, neurodiversity, and compulsive behavior. Yet in the literature, it's rarely addressed anywhere near as commonly as other biophysical comorbidities. For lifestyle interventions to have a shot with a significant percentage of those at risk and living with steatotic liver disease, these aspects of the bidirectional nature of SLD need to be addressed. And finally, commercial determinants. I harp on about this one, but it's highly problematic that metabolic syndromic diets, alcohol, ultra-processed foods, cigarettes are so easily available and so individually damaging, generating obesity, diabetes, hypertension, steatotic liver disease. So the culmination then is the punchline. The missing link in steatotic liver disease is public health, and steatotic liver disease stands a much better chance of being seen as a missing link in non-communicable diseases once a more comprehensive view of SLD emerges, inclusive of public health. So Healthy Livers, Healthy Lives is starting by raising awareness, by sounding the alarm, by engaging with the World Health Organization and societies within the liver field, but also outside the liver field. Thank you very much.
Thank you very much, Jeff, for highlighting many aspects, the whole of society approach, the importance of focusing on children, the social and commercial determinants of health, but also this real need for a comprehensive approach. Fantastic. And we'll hear more from you in the panel in a few minutes. Great. I'd now like to welcome Julian Williams, who is a technical officer for WHO Europe and is stepping in for Kremlin Wickramasinghe, who was unable to attend today due to an emergency situation he had to deal with professionally. Thank you so much for joining us last minute, but also for bringing in that essential, that crucial WHO perspective. Please, the floor is yours, Julian.
Great. Thank you so much, Nicola. Good afternoon, dear colleagues. Thank you so much for inviting the WHO Regional Office for Europe to this really important webinar. We are delighted to be here today. I work at something called the Special Initiative for NCDs and Innovation. And what our office in the regional office of WHO does is we support the 53 European member states of the European region for combating non-communicable diseases. So we usually focus on cardiovascular diseases, on diabetes, on respiratory diseases and cancers. And we do that by addressing the risk factors of those diseases. So unhealthy diets, physical inactivity, tobacco use, alcohol use. And many of these efforts that we have to address NCDs are relevant to liver diseases. There's really important connections here. And so many of the efforts that we're doing for those non-communicable diseases can also contribute to our efforts to address the really important public health challenge of liver diseases. In our region, the WHO European region, which includes Europe, but also all the way to Central Asia, we have around 60% of adults living with overweight and obesity. 1 in 3 school children of primary school age is living with overweight and obesity. And despite the evidence that we have about policies to address this problem, countries struggle to adopt what Professor Lazarus pointed to, which is that comprehensive approach. So, for example, marketing restrictions of unhealthy products, urban planning to allow our children and our adults to be active, front of pack food labeling, school nutrition, breastfeeding promotion, ensuring that everyone, regardless of their socioeconomic status, has access to high quality obesity management services. A comprehensive approach is needed to address the obesity epidemic. Right now, not a single country in the world is on track to meet the voluntary target in the global monitoring framework, which is simply to halt the rise. In every country in the world, we're seeing a rise in overweight and obesity over time. And it's really a priority for us. Another priority for the Special Initiative on NCDs is also alcohol. We know that liver-related mortality, alcohol-related cirrhosis is closely linked to population levels of alcohol consumption. And we also have really good evidence about policies that can help reduce that harmful consumption of alcohol. In 2022, there was a publication on the European Framework for Action on Alcohol, and 3 of the cost-effective interventions were highlighted there related to the pricing of alcohol, restricting its availability, and restricting its marketing. And we know that if we can support countries to implement those policies, it will also be good for liver health and overall health of our populations. Beyond alcohol consumption, beyond obesity, we also see the high levels of tobacco consumption in our region. About 1 in 4 adults is consuming it, and the trends are showing that, especially among women, there are changes, and this is contributing, for example, to cancers, including liver cancer. So I think from our side, there's some key questions. I think one is, how do we integrate these approaches to address liver disease into existing frameworks that we see at the country level and at international levels? And what are the main barriers that we see to implementing these different policies? So we see just challenges bringing together the different sectors, what Professor Lazarus said about addressing the commercial determinants of health. And it's not restricted to liver diseases, it's for all NCDs. And I'd like to close just with the importance of what we'll get to in the panel of just proper documentation of the problem. If we can properly show the burden of liver diseases in our countries, we'll have a stronger voice. And we're really grateful for this, this partnership with the European Association of Liver Diseases, and excited for the conversation that's happening in this webinar. Thank you.
Thank you very much, Julian, and also for highlighting the importance of a systematic, comprehensive and evidence-based approach, how to gather that evidence, highlighting some policy opportunities and successes in various areas, including obesity, alcohol and tobacco. It's a long journey, but also I think importantly you stress the aspect of equity, which is integral to moving forward as well. Terrific. I think we can now then move to our panel, and Julian's also joining our panel as well. If those who are joining the panel could put your videos on, that would be fantastic. So as well as Jeff and Julian, we are joined by Alison Cox, who is the Policy and Advocacy Director at the NCD Alliance. A warm welcome to you, Alison. Jose Williams, who is representing today the Liver Patient International Patient Organization. Jose, warm welcome to you as well. And we have also with us Professor Sergio Paoletti from the International Diabetes Federation Europe. Sergio, it's absolutely great that you're able to join us today as well. So I'd like to start with a question to Julian and Jose. It's been mentioned at the beginning of the webinar, the new nomenclature. I'd just like to understand from both of you, through your specific lenses, what you see as some of the challenges and opportunities around the new nomenclature in relation to SLD, and perhaps you can build on your excellent intervention, Julian, and unpack that a little bit more, and then we'll go to Jose.
Great, thank you so much, and thank you for this question. So for those of you who may not know, for the ICD codes, we often see changes in the names and the nomenclature. And in order for that change to happen, governments play a really important role. So experts cannot initiate that change. We at WHO cannot initiate that change. It has to come from a focal point, often within the Ministry of Health, to bring it to the to Geneva for the proposal. We were discussing before this call the process with the new nomenclature. And it sounds like that has happened. That's in process. You have a member state with a focal point who's brought it for the formal change. I think where WHO Euro can give support is we can help you with future meetings to continue that consultative process with the ICD team in Geneva. Another area we'd like to highlight for work is in the next steps. So even after there is that change in the ICD codes, we can help work with countries to adopt those changes. We've seen that that process often takes a few years. And again, for the very important process of tracking disease over time, defining the problem, we have to work with our statisticians, our epidemiologists to make sure that they're using the correct codes. And so that's another area where we would be really happy to support in this change. Thank you.
Thank you. Great. That's very, very positive, that keenness to collaborate in moving forward together. Excellent. Jose, please, over to you.
Juliana, thank you so much for all your remarks you made. And it's for patients. I represented the liver patients. In general, it's very important that the WHO really supports this nomenclature, and we are very happy with the new names. And probably there will be somebody who isn't, but in general we are. But what I face now is that I know it takes a long time before everybody is used to the new name. But what surprised me is that the old names we don't want to use anymore are still used by a lot of people, by institutions, by doctors, by pharma. And I'm really surprised about that. And then I was thinking about what's going on here and what can we do about it, because that's much more important. And I think that we really need a good implementation plan on all levels and give us a loud voice about this is the new name, because for patients it's so important. And patients they use the name as just the name of their disease, so that's not a problem at all. So but that's very important. That's really a challenge we have to take. And I think a good implementation plan with all the stakeholders from this organization, that will be very helpful also for patient organizations, because they are very often seen as the one who has spread the words. But we cannot do it alone, because a lot of patient organizations, it's not their main issue, so they do it also. But yeah, so we really need more guidance in this, and but also not only a plan, but also what is healthy liver, what is a healthy lifestyle, because depending on where you live, that can really be different.
Great. So call for a collaborative approach, looking at the importance of having a clear plan, but also some guidance about some of the fundamentals, and health literacy once again been really critical. I don't know if other panelists want to chip in here, or we move on to another question.
I'll just add one
please,
point,
Jeff.
Nicola.
Yeah, sure.
So we really appreciate the advice and engagement of WHO on changing ICD. So a submission was made, led by EASL in the US, and EASL and others are looking at how to support this at the national level. I know it's a long process, but it's incredibly important now that leading societies around the world have published and made clear their commitment to the new nomenclature, but also the new definitions that I think we're going to talk about in a minute, but that are so important, where we focus more on metabolic dysfunction rather than just sort of the non-alcoholic side of this disease.
Great, thank you for that, Jeff. So moving to Sergio, how do you feel we could best integrate SLD prevention into existing NCD frameworks and guidance? And what do you see as the intrinsic links between SLD and NCD priorities, and how can we align those more?
Well, it happens that I am a patient affected both by steatosis and diabetes. So this is the reason I was asked to be present here. So in a way, I believe that the complex situation of those diseases needs a complex approach, in the sense that the intercorrelation from the scientific point of view, from the biological point of view, the intercorrelation between the two diseases has been extensively demonstrated. And of course, the diabetes is in the top of the NCDs, but in many cases, origin from steatosis is clearly demonstrated. So that's the first point. The second point is that in the diabetes community, most of the medical community is convinced now that the kind of shame, pain and shame approach that regarding alcohol consumption and physical exercise and so is not enough. I mean, the strict presence of support from authorities, starting, of course, from the medical community and the social community, is absolutely necessary. The individual decision is not the only solution to this point. And last but not least, I would, in a way, go back to my previous. I am a retired biochemist from the School of Medicine of my University of Trieste. And the feeling is that the interconnection between hepatologists and diabetologists or endocrinologists in general is not enough. I mean, that's the point. I think that the holistic approach in the university teaching and formation of future medical doctors or nurses or sanitary personnel is absolutely crucial. And I think this is one point in particular regarding the university community, and so education, that should be strongly stressed also at the WHO level.
So curricular evolution, and also, for example, you highlighted the societal dimension as well as the medical dimension in moving forward too. Great, Sergio. Very curious to hear Jeff's views on this, building on some of your earlier comments.
Yeah, well, thank you, Sergio, for joining us, and I'm so sorry that you're double afflicted. But it's very important to emphasize that most people with steatotic liver disease, particularly SLD and MASH, will have multiple conditions, and I think one reason we get relatively little attention to SLD and MASH is because of the the greater morbidity and more well-known conditions, but also the much greater mortality. Most people with MASH will die of cardiovascular disease. So Nicola, I would just really emphasize the bi-directional relationship, and that SLD and MASH are really the hepatic manifestation of metabolic syndrome. So we're not here as a one-issue group saying, hey, more attention to this disease. It's more attention to this disease because it's causing other diseases. It's a leading cause of mortality, at least as it contributes to those that are the leading causes. I mean, it contributes to diabetes, it contributes to cardiovascular disease. It's obviously a leading contributor now to liver cancer, along with alcohol, to cirrhosis. So I hope with this change to the new nomenclature, we can really seize the moment to raise awareness, and as mentioned earlier, stress the metabolic dysfunction associated nature of steatotic liver disease, and see it grouped and mentioned along with all of the other NCDs, both in WHO, normative guidance, frameworks, action plans, and strategies.
Great, thank you, Jeff. Moving to Alison, we'd love to get your perspectives from the NCD Alliance's work.
Yeah, and thank you very much for this opportunity and invitation to join this very important discussion. From the NCD Alliance's perspective, obviously we're coming at this very much from the global policy agenda perspectives and where non-communicable diseases sit on that. And it's driven by a series of UN high-level meetings, specifically on non-communicable diseases, and then the action plans and deliverables that came from that have been delivered mostly by the WHO. So steatotic liver disease is part of that NCD agenda. Whilst it's not articulated in the headlines of what's sort of described as the big 4 or 5 of cardiovascular disease, diabetes, cancer, lung disease, and mental health, it is part of that inclusive agenda of NCDs, and we hope benefits from the momentum we're trying to build on a global policy level. And it's really interesting hearing what some of the other speakers have said, because absolutely, reflecting on those last few speakers, multi-morbidity is absolutely a key factor. It is for this disease is for many NCDs that multi-morbidity is increasingly the case, both with other NCDs, but also with communicable diseases such as HIV/AIDS. So not looking at this in terms of specific silos or chimneys of health delivery, what we really need is an integrated approach to health services. So
For us, we're trying to drive an agenda for reducing mortality from NCDs by 30% by 2030, which is a sustainable development goal target, 3.4, but is intimately related to a target 3.8, which is the achievement of universal health coverage. So, but I want to take a step back from that. We've also heard really interesting comments about public health and primary prevention on common risk factors around things like healthy diet and active travel. So it was really encouraging to see the Honourable Minister from Egypt recognise this, and Jeff talking about commercial determinants of health and the need for a public health approach. This is absolutely not about lifestyle and individual choices. I really support that. We have to really tackle the much broader determinants of health, social, economic, environmental, and commercial, particularly, and what we're up against there. And then I just want to sort of speak briefly to some specifics around that global policy agenda and where it fits in. So, for example, just recently, last week, with the WHO's executive board meeting, there was a raft of decisions and resolutions went through that. And under the NCD policy agenda item, there was a resolution on specifically on transplantation of cells, tissues and organs, and directives both to WHO and directives member states about better management and delivery and support of these important treatments. But then going straight up to this much broader level, we as the NCD Alliance are now putting our focus on what's coming up next year, which is the next UN high-level meeting on NCDs. We have some really strong messages, and we need to really build momentum and demand for action across what I'd just like to highlight as like 5 key topics, which is accelerated action, actually delivery of all this great policy and plans that have been developed over the last 15 years. Alignment, that's, as I say, the integration of health service and health systems so that they're patient-centric and based on, you know, the real experience. Accountability, so actually calling governments to account to actually deliver what they said they deliver when they set these big targets. And engagement, the importance of engaging both civil society and people with lived experience throughout these processes. So yeah, in terms of your question, we would love to build that momentum in a very inclusive way across the NCD and chronic disease community. Thank you.
Oh, that's fantastic, and a really critical message that it's not something separate. It's really part of that really strong, powerful NCD agenda that's taking up much, much more space, fortunately, now, given the public health crisis that we're confronted with across the globe, in fact. That's great. Any comments, thoughts from other members of the panel on what we've heard so far?
I would just add, sorry, Nicola, I'm always a little late getting unmuting. But thank you so much, Alison. I think those 4 points you made were brilliant. You know, accelerating action, and in our case, we need to start and then accelerate the action, but also the alignment and integration, the accountability, the engagement. And just so that everyone listening is aware, you know, there will likely be an event on steatotic liver disease, a side event at the UN General Assembly this September in New York, and that's going to be contributing to the big summit that you mentioned in, I think, September 2025, also as a part of the UNGA, the UN General Assembly, because we need that kind of top-down approach, because right now, this is a very bottom-up approach. Even if we have leading liver societies and patient advocacy groups here, we need the governments on board. I mean, again, I'm thankful that the Minister of Health from Egypt is here, but we need lots of ministers of health, ministries, and government officials, health authorities engaging on this issue if we're really going to make a change. Thanks.
Absolutely. Super, and thanks for alerting us to that specific meeting for the diaries. That's great. Josie, you wanted to come in briefly.
Yes, very briefly. Alison, thank you so much for your very clear explanation. And I really see a lot of opportunities for patient organizations. We are very focused on a disease, which patient organization you take. And I think that there's always, and that's always also is a long road to go, but that we need more focus on public health, because we are totally not involved in public health. Sometimes, well, very but it's very rare, and I think that's also a change in our world. So that public health is very important also for our, even if we focus on one disease. So thank you for this, and I hope really that we can work together and just slowly go there where we need to be.
It's a great message, Josie. And while you are online and you can unmute again, I'd love to know a little bit more about how you see the fundamental role of patient organisations in moving forward on what essentially needs to be a strong and powerful campaign. I know you're passionate about it. Let us know a little bit about your thoughts on this.
Yeah, well, I think that what we can bring is the unmet needs. What are people face? What are the struggles? Where are the problems? Where do they need more information and education? And that's very important. That's just part of the bigger picture. If you know that, then you know where you have to focus on. And as I said before, we can really play a role in giving that unmet needs and also help to educate people, but we can't do it alone. We are just patient organization. In a lot of countries, patient organizations are driven by volunteers, and they don't have all the knowledge about policy and advocacy. So that's why I asked for guidance, just help people. If you have a good implementation plan with toolkits, and something like that, that will be very helpful. And we definitely can play a role by saying, this is what we need. Yeah, that's really something we can bring in. And in my opinion, it's very necessary to bring that in. And even if we're talking about global policy, it's still important to know what patients need, and what they need, that's very obvious.
Absolutely, and the patient's perspective, the voice, the outcomes and the goals that really matter to them, really crucial. And the fact that there is the patient leadership there, but they need some of the information and knowledge to be able to really activate. Fantastic. Thank you. Moving to Sergio, what do you believe, given your experience and background, what do you believe to be the learnings from the diabetes advocacy community that might be helpful in this space, because there's been enormous inroads in your world of diabetes as well?
Yes, I thanks those speakers who paved the way, and in particular Jose, because I think public health is a key point now that patients' organizations are focused on. Individual goodwill is not enough to combat diabetes. And this is, of course, the same for steatosis. If you allow me, I would just go to the latest document of the IDF on the recommendations to public health institutions. So, these points include establishing personalized management plans, establishing, managing, and monitoring targets for blood glucose levels early, managing and monitoring blood pressure early, managing and monitoring cholesterol levels early, addressing excess weight early, assessing the health outcomes every 3 to 6 months. These simple steps, supported by adequate education and support, have the potential to drastically reduce the risk of life-threatening complications. I believe that, I'm sorry, I have to repeat this point. The individual effort is fundamental, but it is not enough. I think starting from the governmental health organization down to the medical doctors' offices, nurses, and schools. I mean, we have technical ways, the one I mentioned before, like monitoring from blood analysis, the parameters that are clear signals of something going wrong going on. So I think this is certainly mandatory for the public authorities, because only a concerted action between individuals, medical doctors, and governmental institutions can really reduce these factors, risk factors.
Yeah. So
That's our
really
point.
a multi-dimensional approach
Yes.
is absolutely critical. Fantastic. Moving back to Alison, it'd be really interesting to hear what you see as the role of patient organisations in the context of this broader NCD alliance and its mission.
Yeah, sure, thank you. And I would first just really support what Sergio was saying and the reference he was making to the guidance around the importance of about early detection and diagnosis, and bringing this very much reorientating primary health coverage, healthcare and health systems to really focus on these testing and early diagnosis opportunities that could make such a difference. But to your question, we, at the NCD Alliance, we have tried to learn lessons from other social movements, such as the HIV/AIDS movement, that's really showcased that a people-centered, rights-based approach where can make a difference, and the meaningful involvement of people living with and directly affected by specific diseases have been a real turning point in accelerating responses about leaving no one behind. And people living with non-communicable diseases such as steatotic liver disease can be powerful agents for change and leveraging their own lived experience to reach others and help break down the stigma and discrimination and try and bring about change to address the most vulnerable and marginalised. So the views and perspectives of people living with NCDs are really essential at all stages, as I think Josie was saying, from laws and policies through to healthcare service delivery. So, from the systemic to the delivery to the evaluation. So I just wanted to point out a couple of resources and one opportunity coming up. So the two resources are the World Health Organization produced last year a framework for meaningful engagement of people living with non-communicable diseases and mental health and neurological conditions. It is a very thorough document going through every stage and setting standards for what the involvement of people living with NCD should look like. I really recommend it to you. It would be amazing if everybody adopted this. I couldn't believe it when I read myself how thoroughgoing it is. And it's something we should all be waving at everybody we come across. And it's fully supported by WHO. If you look on their website for it, there's a great quote from Dr. Tedros about it that really talks about tackling stigma and discrimination and about ensuring that meaningful engagement. The other one is one produced by ourselves at the NCD Alliance and our Views, Our Voices group. Community. We went through an extensive consultation with 500 people plus in 50 countries, and it's really again a charter that we try and ensure people adopt and use as a living document. So again, really encouraging all of you to see if this is something of value to you and how you can use, and encouraging you, if it's of interest, to join our Views, Our Voices movement, because we really want to bring those voices into the work that we do at every level, from setting strategy to undertaking advocacy.
Fantastic.
And then finally,
we'll make sure that that's included in the report. That those are two excellent resources. Your last point, sorry, Alison.
I've absolutely got to tell you this though, because WHO is planning on holding 3, I believe, symposia on the meaningful engagement of people living with NCDs on the road to this big high-level meeting, this big health summit in New York in 2025. Likely to happen in April this year, possibly the last quarter of the year this year, and then again maybe second quarter of 2025. So please look out for those symposia and bring your voice to those.
Absolutely. Thank you very much for that. Time's really flown and we're moving to the end of this really fascinating webinar. But before I close, I would like us to think again about the title of this policy webinar, SLD, the missing piece of the NCD puzzle. And to all panelists, in a nutshell, when would you consider this puzzle complete, what is the key change that needs to happen? And if you could just do that very briefly in one sentence. And let me go to Jeff first of all.
Thank you. I would stress that an absolute key piece in this puzzle is having steatotic liver disease, specifically MASLD and MASH, mentioned in WHO documents, included in what Alison mentioned, the work on meaningful involvement of people living with NCDs, and a part of this symposia as we get ready for the big UN event in 2025.
Fantastic, thank you. Sergio, your thought?
Unity is strength, so better integration between the different patients associations in the different domains, like steatosis or diabetes or cardiovascular disease.
A very important message. Thank you, Sergio. Julian.
Thank you. I would say I would echo what others have said already about the integration and also this thing of partnership between WHO and also patient advocacy groups and civil society. It's going to be really important. Thanks.
Thank you very much. And Alison.
I can only say, yeah, what would really make a difference is bringing the voice of this important community into the campaign towards 2025. And the missing piece will be governments actually implementing what they set out to do, yeah, in the most integrated way.
And coming then, that's great. And then coming to Jose, last word. Of course, you've talked a lot about planning, the importance of planning and educational resources. But what else is uppermost in your mind, Jose?
Well, looking at all the people here, we really need to collaborate for good implementation. And that's really one of the keys that's we really need to do more working together. So we have a good implementation plan so we can disseminate better the steatotic liver disease, because that's really needed.
Great, very powerful message too. Excellent. Well, I'd like to thank you very, very much, all of the speakers and panelists. You've been tremendous, and I hope that you've enjoyed the experience as much as I have. In terms of my key takeaways, the urgency of the issue, WHO's true willingness to collaborate deeply, the need for a comprehensive, integrated approach that focuses very much on implementation. It is very much part of the NCD agenda, and the importance of making sure that people living with condition, people with lived experience, are part of the conversation moving forward. Strength in unity, as we heard very much during the course of the conversation. Thank you very much to all of you as participants. Please do follow social media links and Twitter or X about this meeting, LinkedIn, and so on and so forth. As we mentioned, there will be the recording online very soon, and please do share this with your networks. That will be fantastic to be able to create this sense of community on this really, really critical topic, SLD, the missing piece in the NCD puzzle. Thank you all very much, and goodbye.
Thank you.
Bye.